Okay, so we're gonna go through phase 1 of treatment. We call this the mobilize phase. In the mobilize phase, we wanna restore the range of motion. If the patient doesn't have tension, doesn't need to restore range of motion, this is more where we can jump on into coordination of the muscles and getting the pelvic floor and core working together. But I like to start with deep diaphragmatic breathing. So I have patients put a hand on the chest, one hand on the diaphragm, and we can practice this in standing, seated, and supine, or really any position. Side lying is a good one. So the key is to keep the chest steady, and then the bottom hand is gonna be the moving hand. And then usually I'll set a 2-minute timer for patients. So maybe we'll go through 2 minutes in a couple different positions, correct the patient. We don't want ab gripping, just the stomach just filling like a balloon. So, you can hear my stomach growling as I do that. And typically I'll then explain to the patient that the diaphragm and the pelvic floor work like a piston. As you inhale, the diaphragm moves down and the pelvic floor moves down and lengthens. So we can use the breath to help lengthen the pelvic floor muscles. And then we can go through some pelvic floor stretches. I always tell the patient they might not feel a stretch, and that's okay. These stretches are just meant to pre-position the pelvic floor in a way that promotes relaxation. Some of them, they will feel a stretch. I like 8 different stretches, and I'll usually go through all 8 stretches with patients. We want to do a sustained hold, typically 1 to 2 minutes. I usually do 2 minutes for each stretch, focusing on the diaphragmatic breathing with the stretch, and having the patient relax their pelvic floor. How do we get them to relax the pelvic floor? I might tell the patient, do a mini Kegel and then release the Kegel. And then you'll know, like, okay, this is tight, this is relaxed. They should be in the relaxed state while they're doing these stretches.